Welcome. I'm Jan Marini, the founder of Jan Marini Skin Research. I am here with Lisa. Lisa's in sales, and she's here for her consultation. So Lisa, if there was something you could change or improve about your skin, what would it be?
Well, the under eye circles, wrinkles, rosacea, and the dryness. Or
Okay. And what type of skin do you think you have? Do you think it's more normal, dry combination? How would you categorize it?
I think it's more dry.
Okay. And do you feel like you're dry everywhere?
Yeah, well, not so much here, but on the outer.
Okay.
And my forehead can get pretty dry.
But you don't typically get shiny during the day? You don't have like any kind of combination?
Not really.
So it's more normal to dry. Okay. And have you ever been a smoker?
Yes.
And are you a smoker currently or?
No.
Okay. And so how many years have you not smoked?
Probably about 3.
Okay. Were you ever a sunbather?
Oh, yes. Still am. So. But I do wear protection on my face now. And my body. But yeah, no, we were on the roof, right? With baby oil. So
baby oil and iodine.
Yes.
I've been there.
Mm-hmm.
I was born and raised in San Diego, and I used to be on the beach as much as I possibly could.
Mm-hmm.
Not only that, but I always started the summer with a really good burn because we believed that was the way to get your skin primed. And then did I use sunscreen? Well, of course, baby oil and iodine, cocoa butter,
yes.
did terrible things to our skin. Okay. Did you ever have acne as a teenager?
Moderate. Not too bad.
So when you say moderate acne,
it would just be random pimples.
Okay, so just so mild,
yeah,
really.
Mild.
And were they just occasional?
Yes. And if I did get a pimple, it would be more like a boil. And it would just be like once in a while. And it would just be, very huge boil.
Okay, so it's more like a nodule or a mini cyst.
Mm-hmm.
Okay.
I still get those once in a while.
And where do you get them when you get them?
Well, I actually have a little breakout here. Mostly my chin and then near my nose.
Okay. So you still occasionally get a nodule?
Mm-hmm.
The nodules, is this something that you've always had since teenage or your teenage years, or is this something that maybe in more recent years you have a tendency to have more of?
Well, they kind of come and go depending upon stress level. Mm-hmm. So as an adult, it's more stress related. But as a kid, I think it was kind of hormonal,
Okay.
So.
And what do you wash with in the morning?
Cetaphil.
Okay. It's actually a pretty good cleanser. And what do you do after that?
I have a vitamin C serum that I'm now using.
Okay.
So in the past, I really did not take it.
And do you know who makes it?
Is it Luminance? I don't know.
You buy it from
Amazon.
Okay.
And then I just use an oil of Olay.
And is this kind of like it's a vitamin C serum? It's like it sounds. It's a serum, not a cream or a lotion.
Not a cream or a lotion.
Okay.
Just a serum.
Okay. And then what do you do after the serum?
And then I do just moisturize with oil of Olay.
Okay. Is it any particular oil of Olay? Because they make some that have peptides and things like that. They make like Regenerous and etc.
Oh, just the regular.
Just the regular old oil of Olay.
Yes.
Okay. And any sunscreen?
It has SPF 30 in it. So.
Okay. Do you know if it says broad spectrum?
Yes.
Okay. You wash with the same thing at night?
Mm-hmm.
Okay. And then do you do the same thing with the vitamin C serum?
Yes.
Okay. And same moisturizer?
Mm-hmm.
on an occasional basis you ever use a scrub or a mask or anything like that?
I will occasionally use a mask.
Okay.
And the brand, I can't remember, unfortunately.
Is it a clay mask?
It is a clay mask. And because I have such dry skin, it would be like once every 2 weeks.
Okay.
You know, because I always just feel like it dries me out too much.
Okay. All right. So, where do you think you have fine lines and wrinkles?
Well, around the mouth, not fine. Those are, and then eyes, the crow's feet, and my forehead.
Okay, crow's feet and forehead. And have you been diagnosed with rosacea? You mentioned rosacea. Have you been diagnosed with
Yes, I have. So I have it on my cheeks. And so I was using Metrogel for a while to treat it. And then it's kind of gotten a little bit under control, but now I'll use it occasionally.
So now, did you feel that the Metrogel did help you?
Mm-hmm. Yeah. I'm my cheek area I will break blood vessels very easily.
So, why is it that you don't use the Metrogel on a daily basis?
Well, I probably should, but it was really bad, and then it's gotten a little bit better, and then I just forget.
And so tell me, before you were diagnosed, were you what we call a flusher blusher? So in other words, if you had some spicy food or you had a glass of red wine, did you flush and blush? Mm-hmm. Okay. And did you ever get what we call secondary lesions, which look like acne on your cheeks? And did that ever occur?
Well, now, like when I get some of these breakouts, I think that's partially rosacea down here. I don't know.
Probably not.
You don't think?
No.
Okay.
Typically, what happens in rosacea is as it progresses, some people can get what's known as secondary lesions, which are papules and pustules. They look exactly like acne. Right. And they can actually scar like acne. However, they're from inflammatory causes. It's not related to acne. If we were to biopsy an acne lesion, the way that it starts, in order to be an acne lesion, there's always what's called a microcomedo. That's the start of it. In rosacea, there's no microcomedo. Different pathology. Now, there are some overlap in that both are considered inflammatory conditions. But what you're having happen down here looks very different than what typically happens in rosacea. And generally it would be in the area where you would typically have rosacea. Right. Now rosacea generally is seen in terms of the characteristics of rosacea in that more of the center U-shaped portion of the face. Occasionally the neck and the chest, sometimes the forehead, but generally it's this area right in here. So we'll talk a little bit more about that. So did you go to get diagnosed for rosacea because you were having persistent redness or what?
Yes, and it just in my cheeks especially. So, and it was like 5 years ago, and because my mom has it, it's hereditary, and so she suggested to go see the doctor and get on this Metrogel because it was really helping her. So,
okay, and the under eye circles, is that something that you've always had? Okay. Well, let me just kind of talk a little bit about a couple of things, and since we start off with the rosacea, I'll kind of go down that road. So rosacea affects over 16 million Americans, and it's probably underreported because a lot of people who have rosacea think that they have adult acne, or they just figure, okay, my skin's kind of red, and they don't ever really get it officially diagnosed. So it affects a lot higher numbers. And generally the onset of rosacea is between the ages of 30 and 50. It affects fair-skinned women much more than it affects the rest of the population, and it affects more women than men. Now, when men get rosacea, which they do, oftentimes it's much more aggressive. It progresses more rapidly. Don't know why exactly. But it's an inflammatory disorder. and it's a disease of vasomotor instability. So you have blood vessels that are designed to expand and contract, and in rosacea, those blood vessels are compromised. And generally, we see rosacea in fair-skinned individuals, and it makes sense. A lot of times people say, well, it's a hereditary factor in rosacea, only that you inherit your characteristics. You inherit fair skin, you inherit light-colored eyes. And so if you have fair skin, you're going to be much more vulnerable to sun exposure. If you've been a sunbather, then there's obviously a chance that you've done a lot more damage to those blood vessels, and there's passive dilation and things like that. It's kind of a disease that's really mysterious in a lot of ways. It's misunderstood. Now, Metrogel is a very common topical that's given for rosacea, and actually Metrogel is part anti-inflammatory, part insecticide, and it's and it's part antibacterial. And the idea is that it was originally for something else, another different type of element, but they found that because it's anti-inflammatory, that it had an effect on some people for rosacea. Some people find that Metrogel has somewhat of an effect. It usually takes quite a bit of time for it to kick in. Other people don't necessarily see a whole lot of an effect with Metrogel. And but it certainly can't hurt to use it. It's not a bad topical. The idea with the part insecticide is that they're trying to sort of target what's called the Demodex mite. Now, there is a belief that in rosacea, this little parasite, we all have them. But in people with rosacea, we don't know exactly why. It may exacerbate or it may be a causative factor. And what it does is that it attaches itself in the follicle. So it's possible that it exacerbates the vasomotor instability or the inflammatory aspects of rosacea. And so the idea is if you can kill the Demodex mite, then you may be able to lessen some of the characteristics of rosacea. And the characteristics would be the fact that people kind of get red. They have, if you look close, the distinguishing characteristic is that they have telangiectasias. Those are dilated capillaries. So they're not really broken. If you broke them or if you laser them, they'd be gone. Right. But they're dilated, so they're noticeable. And they also can be very unstable because some people flush and blush, and sometimes the flushing and blushing isn't just triggered by alcohol or by spicy food or certain triggers, but it is triggered by maybe sitting in a stuffy room, or maybe you're just you're very emotional, you're laughing, you're crying, and you just never know when it's going to happen. And it's a disease of reactivity. So a lot of people say, oh, if you have rosacea, you have sensitive skin. Well, you can have really sensitive skin and not have rosacea. But you can not have rosacea, or you can have rosacea and not have sensitive skin. But it's a disease of reactivity. And so it's dependent on what you're reactive to. And again, some of the common triggers would be caffeine. It could be spicy food. It could be alcohol, particularly red wine. Some people it's chocolate. Some people it's even avocados or berries. Chocolate. And it can be definitely chocolate. Weather changes. There's every person can be a little bit different. And so a lot of it is avoiding some of those triggers. But here's what we do know about rosacea. We know that the root cause now of rosacea is something called the cathelicidin protein. And the cathelicidin protein is an inflammatory protein that we all produce, and actually we produce it for a good reason, because if you cut yourself, you wound yourself, burn yourself, it can actually help in the healing process. It can help to mitigate some of the healing factors, or orchestrate some of the healing factors. However, if you're just producing it randomly, then that inflammatory protein can cause issues. So in rosacea, what physicians do, the reason that sometimes they prescribe antibiotics, for example, not because there's a target organism, not because they're going after bacteria, but because antibiotics are anti-inflammatory. And so oftentimes people see a very good result with rosacea. Metrogel, anti-inflammatory. So that's typically the approach for rosacea. And we've got some things that can really help with the appearance of rosacea. So we'll work on that. And it can be progressive. And, I always say I can line up 10 people and put them on a program, and 9 of them will do incredibly well. And number 10 is like, I don't care what you do. It's for some reason, they just don't respond. And sometimes it's because either there are certain things that are triggers. Maybe somebody doesn't want to give up their favorite spicy Thai food. Or maybe somebody doesn't want to stop that particular type of alcohol that may be exacerbating the rosacea. So those things have to be taken into consideration also. So we'll kind of address that. Okay. Under eye circles. So people used to say to me, Jan, what do I do for dark circles? And I had a sarcastic answer. I would say, well, you picked your parents. It's hereditary. So what happens is that you inherit how close your blood vessels are to the surface. And those blood vessels, if they're closer to the surface, they tend to show through more. Now, generally, if you're a young person or a child, it's not as noticeable. But then as you get older, there's a lot of other factors that come into play. And I would bet that if you have a day where you have allergies or you didn't get enough sleep or you've got a cold or something, they're a lot worse.
Oh gosh, yes.
So you have this big sinus cavity and all the fluids that go through there, particularly like if you're having allergies or a cold or you didn't get enough sleep, all that sort of circulation kind of backs up. And it puts pressure on those vessels and they engorge with blood and circulation slows down. So that's why on those days they're even more noticeable. And so the other factor is that sun exposure damages the blood vessels, it damages the collagen. The collagen layer, your eye kind of rests on a fat pad. And that fat pad is held in place so that it looks nice and contoured with a membrane and with skin. And there's some collagen in there. And so that also can disguise the appearance of dark circles. As that gets thinner and thinner, then those dark circles are more apparent. Plus, over time, and this is not the issue that we're talking about here, but over time also that fat pad can herniate. And that's what makes it look like you have bags under your eyes. Fat also retains water, and so they look even more noticeable. And usually when you're upright after a few hours, then it dissipates, but then over time it's like all day long you have more of appearance underneath the eyes of like what we call bags or puffiness. But that's not your issue, but just I'm kind of giving you some information. So what we can do is we can really minimize the appearance of these under eye circles by taking into consideration some of these factors. Now, then we get into wrinkles around the mouth and the crow's feet in the forehead. So vertical lip lines. Vertical lip lines are annoying for everybody. And what happens probably with you, a lot of that has to do with smoking. Right. And smoking, it's not only just pursing your lips, that can make a difference in vertical lip lines, but it's the fact that nicotine and smoking over a period of time damages blood supply. And that's one of the reasons why physicians don't want to do any type of elective surgery on people unless they stop smoking, because they can end up with tissue necrosis, and it's just really hard for that blood supply to be as healthy as it can be. Now, you've stopped smoking for a while, so which is great. But even if you are in your 20s and you can't even really see the fine lines, if you wear red lipstick, it bleeds into the lines. It'll glow into the lines. So I want you to know, I can wear red lipstick. I'm going to be 60, 77. I can wear red lipstick all day long and it doesn't bleed. And one of the things we're going to be talking about is I use the Hyalip complex, which is something that has a very new type of hyaluronic acid that can actually get in and helps to kind of with the appearance of volume. But it has a peptide that is a lip pumping peptide, and it's got some other things that can really help with the appearance of those lip lines. And unlike lip balms, a lot of times when people think about treating their lips, they rub something on their lips. This is rubbed on the lips and it goes all the way around. So anyway, we'll get more into that. And then the other thing that you mentioned is crow's feet and forehead. So when we get into the aging process, and it can get pretty complex, but we talk about most of what we see is aging, 90 to 95%. You look in the mirror and everybody says, oh, well, I'm getting, my texture is changing in my skin, or I'm getting fine lines, or I'm seeing discoloration. Well, it happens to everyone. Everybody's got to get old. 90 to 95% of what you perceive as inevitable aging is sun exposure. most of which happen before the age of 10.
Oh.
And at least 50% is programmed into your DNA by the age of 20. Now, it takes 10, 20, 30 years to show up, and that's why oftentimes when you're in your 20s and your 30s, you like to think to yourself, oh, I'm not aging. You may look around you at somebody who's 40 thinking, I'll never look like that because I'm not aging. And then all of a sudden you look in the mirror and you start to see aging changes. And I hear all the time how surprised people are how rapidly this can occur. Loss of volume, just fine lines, textural changes, and once it starts, it gains a lot of momentum. And so sun exposure, continued sun exposure, whether it is incidental sun exposure and protective sunbathing, exacerbates that. But then there's something called dynamic muscle movement. Now, dynamic muscle movement, if we were all living in caves and we never had any sun exposure, that has to do with expressions. And it has to do with literally certain muscles working harder than others, like you squint, you smile, you wrinkle up your forehead, and it creates literally a crease in the muscle. When you put the skin over it, you see that line. That's Botox, because what it does is it releases, or it kind of paralyzes, this is a terrible sounding word, but temporarily it causes those main muscles that are making that happen to relax, and other muscles take over. It doesn't paralyze your whole face, but that's called dynamic muscle movement. So we can soften the appearance of those, but, and I'm not here to sell Botox,
Right.
but it's just
not
realistically,
that's your only option.
And that's like the corners of the eyes, for example. I mean, actually, Botox has come a long way, and people can inject it in a very artistic way. Like sometimes you get wrinkles on the corners of your eyes, okay, crow's feet. Sometimes the eyebrow starts to kind of droop down this way. And actually, with Botox, it causes the eyebrow to lift because that muscle is no longer depressed. It gets rid of the lines across the forehead. It can be done for the parenthesis lines. Right. Some doctors can even inject it in the jawline, and it can cause a lifting that way. There's a lot of things that can be done with Botox.
What about the lips?
There's some work that's been done in the area of doing some very modest injections in this area to kind of relax the muscle if it has to do with a lot of pursing, but that is really not what I would suggest for lip lines. So generally for lip lines, there's a couple of things. One would be injectables in which hyaluronic acid, some type of hyaluronic acid, is injected along the vermilion border, which makes it stand up. It also creates a barrier so that when you do wear lipstick, it tends to not get in the lip lines as much. And also you can take what's called fine line, which is a type of hyaluronic acid, and you can inject it into the little fine lines. That's a little bit laborious because even it's really hard to some of those lines you can't even hardly see without a magnifying glass, and yet you still have lipstick that can bleed into them. The other thing along with that is to do some type of a laser procedure, because a laser procedure can in depth resurface that skin so that those fine lines and wrinkles can be kind of obliterated, so to speak. And you can, today there are a lot of lasers which are not as aggressive as the old, what was called CO2 lasers. Now the CO2 lasers were great in that literally, they would just take away layer after layer of skin, but you would ooze and you would be very red for a week or two. Today, they have fractionated lasers, and one of the brand names is called Fraxel. But fractionated lasers, what they do is they make little pinpoint entry points into the skin, so that even though it looks like everything has been ablated, there's actually little tiny pieces of skin in between, which allows very rapid reaffiliation. I can't say that. And what that means is that the skin actually recolonizes, so to speak, very rapidly. The healing is very rapid. So even the deeper Fraxel treatments probably require a week or less. And usually with most of the average Fraxel treatments, maybe there's some redness or a little bit of crustiness for 3 or 4 days. Right. And so usually what you do is you have one treatment and then maybe after that heals, in a period of time, you come back for another one and another one. So that way you're not going through like a major procedure with a lot of downtime.
Right.
Okay, so there's things like that. There's a lot of things that, that can be done for that. But we can actually soften that, and we can make it look a lot better and make a difference in that area. Now, with regard to the dryness, well, again, sun exposure, but also the layer of skin that we touch, and the layer that we're really obsessed about, that we're looking in the mirror all the time, that's actually the stratum corneum, which is a dead layer. We shed about 500 million cells a day. And as we age, those cells sit on the surface longer, and they harden and they cornify, and they kind of shrink up. And they can make the skin feel a lot drier. That's why it typically feels a lot softer after you exfoliate. Or when you first wash your face, and it's the water and your cleanser wets down that dead layer and it kind of stretches out, it feels soft and nice. And then if you didn't put anything on, after about 20 minutes, you'd feel real tight and dry. That's because the water evaporates, it hardens, and it cornifies again. It also can trap oil in that layer, so sometimes your skin feels a lot drier than it really is, because many times when we resurface skin so that it has that really luminous glow, and we want that stratum corneum to be very thin and very compact, the skin will look very glowy and much more luminous and dewy because the oil isn't sitting there in the dead layers. So in some cases, people are not as dry as they think they are. Sometimes they are, but either way, we can address that. And so when we're talking about this kind of skin rejuvenation, and skin rejuvenation, my definition would be anything from the typical, you say your fine lines, your texture, my pores look large, my texture looks dull, my skin doesn't have translucency, it's not all one color, on and on and on, all the superficial imperfections, mild to moderate acne, rosacea, everything. That all comes under skin rejuvenation, because you're not just talking about, I want this part of my face to look better. We all want, we want everything.
Right.
We want our skin to look healthy, we want it to look glowing, we want it to look dewy, we want it to look moist, we want it to look even toned. So it's all of those things. We address all of that, and the appearance of all of that. And so the biggest thing that we can do for skin rejuvenation, the first thing we can do is resurfacing. When you do a lot of resurfacing and you're working with retinoids and you're working with things like glycolic acid and all of that, one of the questions that I get asked, even by professionals, is, gee, Jan, won't I thin my skin? And again, I have a sarcastic answer. I say, I hope so. Because what you really want is you want a very thin stratum corneum. You want that skin that looks really poreless, that looks bright, it looks luminous, even toned, and that, I always say, the red carpet look. They don't look like they're wearing makeup, but they walk down the red carpet and it's this really great glow, even toned glow. But you want your dermis to be really, really thick. So the thinner your stratum corneum is, the better barrier it is. If you look at a 10-year-old, look how thin their stratum corneum is. Look how just luminescent it looks. Mm-hmm. And so you want that to be very thin and compact, because it'll be a better barrier, it'll be healthier. But you want your dermis, which is 80% collagen, to be nice and thick. So we want to do a lot of resurfacing because we want to kind of rev up that cell turnover, right, and just make your skin look a lot smoother, a lot more luminous. And then we want to also use things topically on the skin that can help with the appearance of some of the things that you've experienced. So that's kind of the tact we're going to take. And I'm going to be putting you on the skincare management system. Now, I am actually going to put you on, I think, for right now, and we'll figure out later if we need to do something a little different. But I'm going to put you on the normal combo system, because the reason is that this is so much more hydration than you're using currently. Okay. That I think you'll find that you're going to feel very hydrated. If we need to go into the dry skin system, if Lisa had said to me that she's using a toner, a moisturizer, a serum, and she's using other products, and she still feels dry, then I would be thinking that we need to go to the dry skin system. The other thing that I'm going to do is I'm going to have you use something called Hyla 3D. Now, there's another aspect to the aging process. I know it gets depressing. But as much as 50% of what we perceive as aging is loss of volume. Mm-hmm. So like you have really beautiful bone structure. But one of the things that's great about bone structure is it kind of holds everything up. Right. And there's something called the youthful triangle. So the youthful triangle is where the highest, widest point of your face should be the cheekbones. And then it narrows down into a well-defined jawline. And a lot of that has to do with volume. And that's mainly hyaluronic acid. So as you age, you lose hyaluronic acid. You produce less hyaluronic acid. Hormones cause you to, hormone differences and lessening of hormones cause you to produce less hyaluronic acid. And really, particularly when you get in your 20s and 30s, it really starts to decline. And this is a major factor in volume, even throughout your entire body. So what happens is eventually that youthful triangle, literally you could turn it upside down. This part of the face starts to flatten. It moves down. You see a nasolabial fold. You see things happen at the corner of the mouth. And then this part of the face actually becomes wider, and it can be wider than that upper triangle part. You just literally turn the triangle upside down. So one of the reasons why injectables are so popular is because they give back volume. I mean, people can have facelifts, but their face starts to look skeletal. So we want that three-dimensional volume. That's what's so youthful. And all of your injectables, for the most part, are done with hyaluronic acid. Hyaluronic acid is not what actually gives the correction in an injectable. Temporarily, yes, but what it does is it provides a framework for collagen. So collagen forms, and that's what maintains that correction. And depending on what part of the face the injectable is done on, that determines how long it's going to last, because if you have a lot of movement, it'll break down faster. And also how cross-linked is the injectable. So in some areas of the face where there's not a lot of movement, they can do more of a cross-linked hyaluronic acid. It lasts longer and there's less movement. So, for example, voluma in the cheek area could last 2 years. Oh. So my point talking about that is that when you have hyaluronic acid in skincare, it's a great moisturizer. It holds about 1 to 10,000 times its weight in water. I've used it for years in lots and lots of things. It's a very large molecule, though. It sits on the surface of the skin, and it's great because it actually can increase the water content, but as opposed to just keeping it from evaporating. But it also is very short-lived. It's a large molecule. It doesn't penetrate. When we talk about Hyla 3D, this is a real game changer. These are actually tiny little molecules that can get into the skin. They can penetrate. And so it doesn't replace injectables, but in terms of the appearance of just the skin looking plumper and more volumized, and it really is a game changer. So we're going to work with that as well. Also, in terms of the dark circles, Luminant Eye Gel. And we're also going to be talking about something for the rosacea as well, which would be a product called Rosalie. Now, do you have any questions for me?
With the injectables, I've been thinking about it because I have one cheekbone that is larger from an accident when I was a child. And so my right cheekbone is larger than my left. So they're able to just kind of, where do they inject? Is it,
actually they can even things like that out. Voluma is done with something called a cannula because it is a more viscous form of hyaluronic acid. It's heavily cross-linked. Mm-hmm. Now, the interesting thing about a cannula, it's much larger than a regular needle. But with a regular needle, tiny little needles that they do, like, say, Botox and injectables with, those tiny little needles actually can nick blood vessels very easily, which is why people get bruising. Right. The cannulas push the blood vessels aside, so you get very little bruising. So what they do is they have an entry point, and Voluma is literally injected very deep, kind of near the bone. It sounds terrible, but it's It's not something that's, like horribly painful. You don't have to be like put under general for that.
Right.
But what they can do is they can actually even things out. But the thing about Voluma is that it's a product that can lift. So it tends to pull things up, as well as kind of giving a very nice, youthful, swept up look to that area.
Right.
But this is something where you go to a really good injector and they evaluate the face and they really look at what are some of the best options and the best types of injectables for a particular area. There's just a lot of options today.
Yeah.
I should be getting a commission for this.
You should. We're going to talk more about it. But I'm excited to use your product. So
Thank you.
I'm really excited.
And so what we're going to do is we're going to continue to work with Lisa, because we may at some point we need to modify her program, and also seasons change, skin changes. Maybe Lisa will say, gee, my skin feels so hydrated, and maybe we actually need to modify something in that respect. We don't know. But also we want to constantly sort of upgrade her program, because even if Lisa says to me a month from now, wow, my skin's looked the best it's ever looked, I can make it better. So continue to work. So I'm excited. And do you have any other questions for me?
No, I want to get going. I just want to start using it. So, I am excited.
She's going to leave here, go in the bathroom, and just put it on right away.
I will.
Lisa, thank you. It's been a pleasure. And thank you so much for tuning in. I will see you again soon. And don't forget to subscribe. Bye.